My name is Dr. Richard Cross. I'm president of the Eye Health Institute. EHI was started because of the overwhelming need down here. I came down with a medical mission to provide eye care, and the team was so overwhelmed by the need that we had to turn away hundreds of people. So Dr. Myers and myself, along with a couple more opticians, returned to try to see the patients we had to turn away. That grew into another clinical mission, and eventually we came back so many times that the Ministry of Health gave us space to use a permanent clinic down in Hanover to continue helping people.
I'm Brian Grimes, the Vice President for the Eye Health Institute. In terms of our teams, what I find so amazing is that we get a team of people no one has ever met before. They come from all over the country, from New York, California, Michigan, Colorado, and instantly gel into this amazing team that provides services to people they don't even know, they've never met, and the compassion that they exhibit is fantastic.
My name is Peter Andrews. I'm an ophthalmologist who specializes in corneal surgery. We've been working with EHI since 2008. That was my first trip down to Jamaica that year to do surgery. Yesterday we were at Lucy Hospital, which is a small hospital on western Jamaica. They have a small procedure room. They do have an operating room, although that is defunct. Small procedure room, but it's big enough for us to roll in cataract equipment. So we have a microscope that we leave here, that we brought here. And this is the first time we actually have a phaco machine, which is the modern way that you do cataract surgery in the US. Prior to that, we've been doing manual cataract surgery, which works, but takes longer, and takes longer to heal. Saw about 10 or 11 patients, did surgery on 5, which is not a big number that we'd like, but it was the first time getting certain things working there. In the US, with our setup, we could do 25 or 30 a day. So to do 5 is frustrating. Our goal is probably more like 10 or 12 a day. Once we get it working, that'll be better. I think a big difference with EHI, there's been a lot of various groups that have come through. They come in, they do good work, they don't come back. But I think EHI has earned the trust of the people in the community that when we say we'll be back, we've proven it. I mean, Dr. Cross has been doing this for 20 years.
One of my favorite things about volunteering with EHI was working in the school screenings. We had a small boy come in. He was probably about 6, and he'd been failing in school. His teachers thought that he was learning disabled. He was beginning to think that he was, something was wrong with him. And we gave him an eye exam, and it turned out that he was actually just extremely nearsighted. So we made him a pair of glasses, and he was able to see.
Susan Giancosti, and I am an optician.
What's your favorite thing about working with EHI?
Helping the people. Working with all these people down here and realizing as I make their glasses how nearsighted and farsighted these people really are and the need for vision. The challenging thing, working with old technology. I didn't work as much with the patients. I do the glasses part, but the cutting of the glasses, it's very primitive. So going back to the old days of what we used to do. Putting glasses together with the screws and how they go together with the thick lenses because we can't use the materials we can in the States. That was very challenging trying to put those together. I have many holes in my fingers.
Because I couldn't read the New Testament, the Bible, not at all. And I couldn't read in light.
Really?
Yeah.
And now you'll be able to?
Yeah.
I think it really helps the community.
My favorite thing about working down here has been working with the patients and the interns and the other doctors that have taken time to come down here.
I'm Jennifer Hugh. I'm a clinical professor at SUNY Optometry. I came when I was an optometry resident, so I was still in my training, and it was nice to come because Rich gave me a lot of autonomy and I was able to learn a lot, so I thought it would be a great learning experience for future interns. And since now I'm working at the optometry school, Rich has welcomed multiple interns and they've been great and they're learning a lot.
At SUNY College of Optometry in New York.
Student at Western University College of Optometry.
SUNY College of Optometry.
I always knew that there was a great need here, but I didn't really realize how much until we got down here and started working at the clinic.
It's great to know that you're contributing to the community, not just local, but a global community, so it's really nice.
It's really opened up my eyes into what optometry really can do, what we have to offer the world, and how you can make an important and positive change in people's lives.
How much I can do just as a student intern to help people and use my skills, like what I've learned so far.
Totally fuels what I want to continue doing.
It's been an eye-opening experience.
There's so many favorite parts. The culture, the people are the best. There's tremendous challenges with the poverty and healthcare system.
They don't have air conditioning, they don't have windows in a lot of their houses, Some of them don't have running water. They don't have the finest clothes. I mean, they have clothes to get around in, but they're not fighting for the finer things. They're just trying to exist and live, and they're not complaining about it every second.
One thing in these developed countries that a lot of people don't know is that if you lose your vision, you can lose your livelihood, and you can lose the ability to live on your own, your ability to care for yourself, and your life may come to a premature end because you simply can't care for yourself. And if you can restore someone's vision and restore someone's life, then you can really do a lot of good.
My favorite thing about coming down here is really just seeing the people so appreciative and patient and working with you, and definitely helping them. A lot of them go through life without ever seeing a doctor even, let alone an eye doctor. I couldn't imagine going in a day of my life without being able to see or being even blind, so being able to give somebody else that gift is a special thing.
We had a gentleman that had prescription so high at like -20, and when we finally fit him close enough to his prescription, he could see for the first time, and it was pretty amazing. Some people were very, they could see for the first time and they would start crying and thanking you for what you were doing for them, and that was just kind of a moment like, I think I want to continue to do this.
It's so rewarding being able to help people in need. There was a man we saw yesterday who had glaucoma so bad his pressures were the highest I've ever seen. Being able to treat him was rewarding. That's a case that probably would never been caught.
What's the hardest thing about being down here?
Having to quit when there's still so many people in need. You still see people lining up to come in to get eye care, and there's only so many hours to go around.
Our model is to not just drop into a place and see as many people as we can and leave, but that we provide their eye care. We're tasked with the eye care responsibilities for the 19 regional health centers around our clinic, so they refer patients into us. We are their go-to providers. We see the same patients every year, so that continuity of care to me, again, is important, that it's more than just a numbers game and parachuting in, that we're here for the long term. We've been here over a decade.
I expected some beaches and nice environments, but I thought that a lot of people just maybe didn't have access to cataract surgery. People are just trying to do whatever they can, and wait times for surgery here are in terms of years waiting for surgery.
What does EHI need?
We need a lot of things. We've had a surge in volunteers lately, so it's been great, but we need more equipment to be able to use those volunteers efficiently and wisely. The equipment is definitely an important thing. We go through equipment pretty quick down here because of the humidity.
The challenges of the humidity, that we need to replace and repair our equipment constantly, more often than you would in the United States, where you're operating in a nice climate-controlled, air-conditioned office.
So I think there's definitely a lot of different equipment and more modernized equipment that if we had, we could get through more patients more quickly.
More people who could come down here and see what we see and feel this feeling we get when we're here to help these people.
They need medical care, they need eye care, they need glasses, they need cataract surgery, they need sunglasses. Being so close to the equator, you see more cataracts, you see people needing reading glasses sooner. We take so much for granted.
You know, we've relished being a grassroots organization. Everyone pays their own way. Nobody has on salary, so we're doing it because we want to make a difference and we have a passion for it.
Dr. Cross really needs to be commended for his hard work, and I mean, he's been devoted to this for decades, and he's really made a difference in the lives of people in Jamaica.
If anyone would come down here one time and see what we are capable of doing in a trip, and if we had more support, I mean, how much more we could do in a trip.
They're doing a great job. I love them. Every year they came here, I'm here with them.
Members of staff here, the principal, the entire school art body is very grateful for this kind of effort, and we want to ensure that this partnership continues.
Wish you all the prosperity.
Thank you.
Working for others, and the Lord will bless you for what you are doing. I love you.
Our vision for the next 3 years is to obtain a climate-controlled facility, to expand our relationship with the optometry schools in North America, to give their interns a chance to experience optometry as a global profession, to continue to work with the University of Michigan in providing access to more eye care facilities on the island through the Third Century Initiative project, and to work with the Kellogg Eye Center in providing more surgical care and even optometric services in partnership with them and with the Ministry of Health to serve the people here.
My favorite thing about coming down here has to be
the impact that we're able to make on the communities by taking the time out of the year to come down and see these people.
I love helping the people. The people here have a sweet spirit.
The patients are so appreciative and the people are so wonderful.
It's a smile on someone's face is always the best.
Being able to see people that normally wouldn't have any access to eye care at all.
all the patients that were sitting there all day long, and when they finally got their turn, they were so excited.
You have a purpose to come back. You don't know what you are doing. You are doing fantastic. Blessing for others. You don't understand, but God understands.